I'm personally convinced that digital microscopy and 3D will not just change our OR and our daily life, it will be the future. So please, Lukan.
Thank you, Professor Chariot. I want to thank Alcon for having me here and welcome dear colleagues on this amazing lunch symposium. I want to share if and how the technology transformed my surgical experience by transitioning from analog surgeon or analog viewing surgeon to a digital viewing surgeon. These are my disclosures. Please scan the QR code in order to be able to vote in the questions that will be given during the session. And first of the question is, are you considering to add a 3D visualization system to your analog microscope? These are the options for the answers. Please vote. Okay, we start quite optimistic. Let's see. Now, this is actually the core slide of my presentation, which depicts how the Ingenuity system paired to the Revalia microscope, which is part of the visualization ecosystem of Alcon, is transforming the analog approach to our surgical visualization. The main focus is actually the patient safety. So we reduced endo-illumination or exo-illumination, we might assume that we can induce less phototoxicity. We don't need to refocus the microscope during the surgery, which is especially important for presbyopic surgeons. I will explain later why. Also, no need to view multiple sources of information because we have data fusion to see the specs of our machines, and also we have connectivity with Argos, for example, for toric guidance, or we can connect whatever we want outside source of data and to use the picture-in-picture capability of the Ingenuity. Now, as I mentioned, in order to maximally benefit from the digital visualization, you need to pair the Ingenuity system to a good microscope, because we need to know that the microscope is the objective of a camera. As better the objective is, as better our image would be. So this is something interesting, which is happening nowadays, because I remember that probably more than a decade ago, the stereo coaxial illumination was introduced in the world of microscopy, and then nothing really happened. Now here we have an objective which is above the illumination source, and it provides a number of benefits, main of which is increased depth of field by maintaining contrast and illumination. This is something which avoids the laws of physics, where the light intensity, horizontal resolution, and depth of field are related. So here we gain depth of field without sacrificing contrast, which is important. Also, the illumination system of the microscope is not focused and provides more consistent red reflex. And this is an example of that. This is a comparison of Lumera first generation on S7 stand with a Revalia microscope. You can see the stability of the red reflex with the Lumera and with the Revalia. And you can see that basically we don't lose the red reflex no matter where is the microscope and how we tilt the eye. And one thing which is important in this video is that on the Revalia I'm using 40% of the light of the microscope, and on the Lumera I'm using 100% of the microscope, which relates to this slide, where in the user manual of Zeiss and Leica is stated that the maximum time in illumination, high illumination in aphakic eyes is basically 10 times smaller compared to the safety time which you can have with the Revalia microscope. And this is related to the focused through the objective and non-focused light on the Revalia, which is again important for the patient safety. Now you can see actually the depth of field that you might get with the Ingenuity mounted on your microscope. So we can recognize here a vessels of the fundus with light from the microscope, and if we need to calculate the axial length of the eye, 23.5 let's say is the average one. So we have increased depth of field, which is actually enormous. So this image is spectacular in my opinion. Depicts the ability of the Ingenuity to increase our depth of field perception for the eye. So I said something about the presbyopia. This is a term, instrumental presbyopia, meaning that the amount of depth of field that a given surgeon can have with the analog microscope is directly related to his accommodation. So for a younger surgeon, everything is fine because they have a good accommodation. But for a presbyopic surgeon, the Ingenuity gives absolute independence from the presbyopic changes in our lenses because it is a far vision. I see this as a benefit during my surgery. Now, this is an example of how we can digitally filter the image. This is the fundus enhancement filter, which I developed 2 years ago. And it's based on the yellow wavelength, which is 577. And since it's a longer wavelength, it penetrates better the eye tissues. And the aim here is to highlight borders in between tissues with similar transparency. For example, capsule rexis and cortical material or the lens. So you can see here when we change the filter, this is basically the normal view of the microscope, and when we chop the pieces, they became untransparent. When we switch to fundus enhancement filter, suddenly the pieces start to glow, meaning that they are transparent and I can safely see how deep I can chop, how deep I can bury my tip, and I think it makes me more safer for the patient and ultimately for me, of course. This is the contrast enhancement filter, and paired with the magnification demonstration which you might have with the Ingenuity mounted on a microscope, and you can appreciate the black and white differences, albeit the structures are similarly transparent. So I see this as a beneficial approach which goes beyond the limits of the analog view that we are used to see during our surgeries. So this is another interesting thing. It is achieved by mounting two Ingenuity systems on stereo bridge on single microscope in order to be able to simultaneously compare the regular microscope view with the filtered microscope view. The technicality behind the image is that we are using picture-in-picture options of the Ingenuity, but still the idea here is to appreciate the level of data distinguishing on the right image and on the left image, because sometimes on the classic analog image we don't see too much details. So this is irrigation aspiration, again contrast enhancement filter on the right side. So it requires a different mindset to see the eye in different colors, not the colors but the tissues of interest which we want to highlight with our color modifications. And this is completely accessible for the user because the Ingenuity is open platform. Now here, another example of how the digital filter can help us. Can we please play the video? Yeah. This is a intumescent cataract, obviously. and this is the regular view that we might compare to our analog view. Here, this is a filter which is made to enhance the blue spectrum of the image. You can perceive the digital filtering as dismantling of the composite color image and taking only the wavelength that we might assume that will enhance our area of interest. And then the best thing is that it is done real time, no latency, no Photoshop, so we can use it during our surgery. This is another type of filter which is focused on the blue enhancement, because obviously here we need to see the capsule. This is the regular view. This is the modified digital image. So I think it's beneficial to see better the edges of our rexes. So here it's another video which is visionary and it's made on purpose. If we are filtering all the image, we might lose a peripheral information. For example, here we have a fundus enhancement filter, and we see better the fundus, but we lose details on the limbus and on the conjunctiva. So I dream, or I want to ask Alcon to make this possible, to have a drag and drop area on which we can choose our own filter, for example, angle, if we are going to do angle-based surgery, and to highlight only this area which is of interest at the moment, and the rest of the eye shouldn't be filtered. That way we will have more natural perceiving of the eye and the environment. Otherwise, you can see here how we lose image data where we don't need it, luckily. But it's an issue that I think would be better addressed if we can drag and drop this area and we can play with the level of intensity of the digital filter. I'm sorry, again. This is angle, please play. Yeah. This is angle visualization through a gonio lens, and if we apply the same filtering approach, we might see better the structures and the anatomical borders of the angle, and we might aim better our gonio-based procedure or stent. Now this is another filter which might be useful in the glaucoma, because this is vessel autofluorescence, and we might see the blanching phenomenon when we are doing angle-based surgery, and it might be beneficial because we can see the vessels. This is another example of the autofluorescence filter. There is no dye in these vessels, and this is a normal light from the microscope, just a digital filtering, so it's not invasive one. And also the Ingenuity seems to be capable of infrared imaging. So this is a mammography with Ingenuity, again, digital filter approach. So the borders are limitless, actually, what we're gonna see with digital visualization. And since I'm vitreoretinal surgeon, I find this extremely useful. This is intraoperative fluorescein angioscopy achieved by digital filter only. No hardware barrier filter is there, and especially in advanced diabetic cases or cases of other vascular pathology, it might be useful in terms of diagnostic device, so it's not only visualization system, but intraoperative diagnostic device and navigational one. Now you can appreciate late phases of leakage, edema in the macular area. So this is advanced proliferative diabetic retinal disease case. And this is how you can see the vitreous. I call it fluoroscopic vitrectomy, because the vitreous is transparent. And since Mahemer introduced this vitrectomy as an operation, we actually anticipate where is the vitreous. Now we can see it, and we can even see the Schlieren phenomenon with the supraretinal fluid drainage. So again, I will emphasize that it depends from us, the users, how we will expand the abilities of the digital visualization. Again, I will ask you to scan the QR code. And another question, if you have or planning to have a 3D visualization system in your practice, what do you think would be the most desirable features for you? Integration with other technologies, teaching and using with the screen, digital image optimization and visualization enhancements, advanced in visualization parameters, depth of field. I would add, or all of them actually. So it's a tie, probably. Thank you for your attention.
Thank you so much. I think